Welcome to our session today, talking about peer observation. I think I know all of you, I know almost all of you. My name is Shari Whicker. I am Senior Director for Professional Development at the hospital and Assistant Dean for Faculty Development over at the medical school. I'll let Dr. Cleveland introduce herself in just a minute, but I just wanted to say peer observation, it's one of my favorite things that we offer. It's just so customized, faculty development to what you're doing to each individual. And while we're going to focus most of our discussion on the service that Teach offers, our teaching academy. However, all of this content exists and is relevant for across the board. If you have a peer, somebody else that you respect as a teacher, as an educator, who you would like to have observe you, all of the same concepts translate for that as well. So anyway, Dr. Cleveland, if you'd like to introduce yourself.
Sure, I'm Jen Cleveland. I'm an assistant professor in basic science, and my primary role is pharmacology. I trained as a pharmacist and then came into education roughly 12 years ago. Started with PAs and now full-time with the med school students. And as my role within Teach, I'm also the subcommittee chair for our teaching consultation and observation subcommittee. So that's how we're intertwined between the two different schools. So it's exciting to be here, and thanks for the opportunity.
Absolutely.
All right, so our learning objectives today is that we really want to go through and share some of the benefits of the teaching observations and what everyone could potentially get out of them. We want to talk about what the observation process is and what it is not. And we also want to go through and talk about the process, how you can go through and actually participate in a teaching observation process. So what is a teaching observation and who is it for? Okay, so teaching observations, sorry, something else flashed up on the back screen. It got logged out on the back one, sorry. Okay. So teaching observations are for educators like ourselves who are looking for ways to improve our instruction skills. For those who are curious about new approaches and instruction methods, and for those who are interested in finding new ways to convey knowledge and information to our learners. Our Teach program has structured an opportunity that's available to all, okay, so available to all throughout our system. So RUC, VTC, SLM, Carillion Clinic, all of our educators, and we pair them with experienced educators who are looking for ways to improve their teaching skills. These observations are going to provide objective and also confidential feedback. It's going to be to our participants and can also go through and provide some resources and ways that we can go through and improve our skills. So let's dig into why an observation may be helpful. So these are some of the ones that we came up with. It's a way to have some honest, unbiased feedback on one's teaching. It's a way that you can look at what's there and you can either scale it up and get some perspectives on what you're already doing and how you can emphasize and make that better. You can balance some new skills with what you're already doing, and it doesn't take much, like you said, having like a little bit of a gap and then finding out what it is and tweaking it just to make it a little bit better and more engaging for your learners. New pedagogical approaches. So at the med school, we've been really pushing and moving to having a complete active learning environment. And so our second years, we don't have any didactic lecture. It's all active learning and application of knowledge. And I guess one of the most important ones is at the end, it's a safe environment that we can go through and we can talk so that we can maximize our teaching potentials. Another reason is for those that are on the tenure to title track. This is a requirement. It is one of those where it is required to have 2 teaching observations, and there needs to be a gap within 6 months, so you can have an initial one and then a follow-up at the earliest 6 months. It could be any time after that or longer, but at least 6 months in between to gauge any type of progress and implementations of new strategies.
So while this is a current requirement for tenure and tenure to title track promotion, word on the street is that eventually, AKA July 1st of next year, possibly, it's going to be required for everybody going through the promotion process. And why we thought it was so timely to have this session now is because, as Jen mentioned, you can have as much time in between two observations as possible, but you need to have at least 6 months. So imagine, if you will, pulling together everything for your promotion packet, doing all the things that you all do in your busy daily lives, and also trying to balance having at least 6 months between two observations in a year's time that you're trying to prepare for promotion, right? Which is why we really encourage folks to try to get, have your first observation done before you even enter the promotion process, right? Because then, what they really want to do, they just want to see that you've grown from your first observation. So if you have one now and you're not even in the promotion process yet, maybe 2 years from now, you start the promotion process, then you can have your second one to show some growth. Okay.
All right, so let's talk about what observation is and is not. So what it is an opportunity to have a confidential process where you can go through and you can get feedback and improve your teaching, and you get that individual development that you're needing. It's an opportunity, as we just discussed, for a promotion portfolio. And we have a great group of experienced educators who genuinely care about teaching and your teaching success. And so it's a way to get to be a part and have a relationship and even mentor with that person. What it's not, it is definitely not critical in nature. Okay? It's not punitive, it's not evaluative. This is truly just formative. It's just to get feedback on what opportunities are there and really what you are already doing exceptionally well, and then how you can tweak it just to make it a little bit better. And it is not focused on content, so it doesn't have to, for me to go and evaluate, it doesn't have to be pharmacology content. It's truly the process and your teaching. So with that, I'm going to turn it over to Dr. Whicker and talk about how to get started.
Yes, so lots of great things about the concept of observation, right? So how easy is it to get started? It's just so easy. So right here we have a link, and you will have access to this presentation, but also at the end of our presentation there's a QR code. If you want to just take a little picture, you can do that, and that will bring you right to the same link on the Teach website, or you can just go to the Teach website, poke around, and you'll find it under Educator Resources. Okay? So, but really, if you want to start the process, just in your mind, think about all the teaching that you do and which teaching opportunity might be the best to have an observation on. So is it something that you've been doing for a while and you feel pretty confident in it, but you're like, I might want to spice it up a little bit. I might want to change it up. I might want my learners to be more engaged. So we saw this dramatic increase when we started, around March, April, May, June of 2020. If you could all think of, what was happening then? So everybody was going online all of a sudden, right? And really without much practice ever doing so. So a lot of folks said, hey, I really need to learn about how to engage my learners from a virtual environment. So we either did a consultation, which is also an option, which is this minus the observation, just talking it through. We did a lot of online observations, and you'll see all the different opportunities that are appropriate for an observation. So you go right to this link, choose your observer. I think we have about 10 or 11 observers as a part of our group now. You'll see who they are. We usually strongly encourage choosing somebody either just really outside of your own discipline, so that you're not concerned these are all skilled observers. They recognize the importance of not being focused on the content, but just so you're comfortable that they're not focusing on the content, and so you're not distracted by that. I learn every time. I'm non-clinical, so I learn something clinical every single time I go to observe. But I'm not focused on the content. I think it's interesting, but I'm not going to be the one, if I'm the one correcting you on something clinical, you might want to double check the facts there, because it's not for me to correct. So we also strongly encourage providing as much advance notice as possible, right? We know y'all are busy. We know sometimes this isn't on the forefront of your mind, and that maybe you have something coming up next week and you're like, oh shoot, I'd really like that observed. Submit it, we'll do it, we'll figure out who can do it, we'll work with you, right? But just remember that this whole observation group, they are folks that most of them are just as busy as y'all, and this is something that they work into their schedules on the side. So in order to be able to have the most opportunity to get the observer of your choosing, just provide as much advance notice as possible. And then once you fill out this form online, super quick, super brief, usually it's Deb who will respond to you, and she'll say it may take a few days, but she'll respond to you and say, hey, I am putting you in contact with your potential observer and making sure what she's doing in the background. The reason why it might be a few days is it goes to Dr. Cleveland as well. It goes to Deb. They're trying to figure out, can this person that was chosen, do they have the time to do it at the chosen time? Or do we have to find somebody else? And sometimes that person is busy at that specific time. And so we'll say, okay, Dr. DeMott is busy. Would Dr. Cleveland suffice in this situation? Okay, so once you submit that, once Deb contacts you, once you're connected with your observer, it's a 3-part process. So what your observer should do is schedule a time to meet with you briefly. It can be in person or virtual, whatever you want. I usually prefer to meet in person for these pre-meetings, mainly if I don't know the person I'm going to observe very well, because I want to build that connection and help them feel comfortable that I'm there purely for their benefit, purely not to criticize at all, not to pick apart what they're doing wrong, but just build that relationship to say, I am here for your benefit. I care about your improvement. So that's the pre-observation meeting. You're going to talk about the venue. You're going to talk about certain things like, because remember, it's so broad. There's so much you can observe, right? During an observation session, so much involved in teaching. But if you will help them to pinpoint what you're looking for assistance on, it really makes it a lot easier for them to focus. Okay. Then the step 2 is the actual observation. You set a time to do the actual observation, and then you come and do it. And it's during that first session, you'll talk about, okay, do you want to introduce me? Sometimes people will say, okay, this is Dr. Whicker. She's here to help me to learn how to better teach you and improve your learning environment, okay? Sometimes I'm just a fly on the wall. Nobody really notices, or maybe they do notice, and they're just like, who's that woman? And it doesn't matter. I'm just back there, and I'm taking my little notes. So sometimes it makes it a little bit easier depending on the venue, right? I've observed in all different situations. Sometimes if there's a patient involved, they don't really care because there's this big group of people going from room to room anyway. And if they're introducing people, they just think I'm another one of the clinicians. But sometimes if I'm sitting in a small group setting with in the back of the room, and people are like, who is that person? They'll introduce me just so it's not uncomfortable and people aren't wondering. And sometimes the faculty members like for their learners to know that they're taking this step to improve their teachings to benefit them ultimately. And then after the observation, usually give your observer time to collate their notes, and then you will get a post, like a debrief session. You'll set a debrief session up, and then that's the time at which you get your feedback. And I don't know how everybody does it, because we don't have any set way to do this, but we do have an observation rubric. And sure, I go through and I check the boxes, how I think folks have done. However, that's not nearly as meaningful as the qualitative feedback at the end. Like, I will give lots of notes, and I will say, here are the things that I think you did really well. Here's something that you might want to try differently if you're trying to engage your learners more, or if you're trying to connect with them more. And then during the debrief, that's the time that we discuss that whole situation. And sometimes what I do is, generally, when I'm giving feedback to somebody, I ask them, how did you think that went? How did you think you did? Did you notice anything different? And then sometimes the faculty member will fill in the blanks in ways that I didn't even consider. They'll bring out things that they were concerned about, or, oh, I noticed that I kept doing this, or whatever. And then it's an added opportunity for consultation, right? And then I'll just go through each of my points, and then it's a really great discussion. And that's really where folks have found the benefit, is in that customized approach. This isn't just, okay, we're going to a session with 25 people in the session, and we're all going to take a little bit of something from it, right? This is purely directed towards the individual. Okay, so this is just, I've got 3 slides showing all of our observation committee, our consultation and observation committee, right? You too could have your lovely picture up here with a little bio. I just wanted to provide an example. This is all on our website, and you'll see a bio for each of us, right? So we've got clinicians, non-clinicians, basic scientists. We've got folks who are, so Dr. Fortuna generally he likes to focus on simulation only. That's kind of how we wrangled him in to do it. We've got somebody who's retired. We've got somebody right in the audience. We've got several somebodies right in the audience. And Misty also, usually does simulation observation only. Okay, so we asked our observers, okay, so what is some advice that you could give? So two folks responded with some points. So the first one is be specific about what you're looking for. I already alluded to this a little bit, right? When you're in an observation situation, especially, so sometimes I'll go to an operating room, for example. There's a lot going on there. I am intrigued by everything in there. I'm there specifically to focus on the teaching, but there's so much going on, right? So if you are specific about what you really would like observed, that makes the most difference. So somebody I observed recently in the operating room said, you know, I've got this diverse group of learners. So I've got an NP, I've got a nursing student, an NP student, a nursing student, I've got a resident student. How can I make sure that I'm giving adequate attention to each of them? And they walk away feeling as if they've learned something, and I walk away feeling as if I've taught something, and the patient is safe and all better by the end, right? So that's a big tip. Another one. This is just their comments and why they think observation is important. It's a key to improving. So they suggest, even before you do this or whenever, videotape yourself teaching. It's really illuminating, right? If you, back in when we had answering machines, I couldn't even listen to my own voice on the answering machine. I can't even listen to myself videotaped. I don't like doing it at all. But this observer did suggest videotaping yourself. And that's its own sort of peer observation. But then you can note the things identify the things that you would like to work on. So if you use a lot of filler words, or you're not engaging with your learners, or whatever, there are so many things that you can identify yourself that will help you to narrow down what you would like the observer to focus on, okay? So who, I say who can participate in the observation process, but it's really whoever, right? Anybody can, anybody who's a part of the medical school, the hospital, and Radford, anybody who's engaged in teaching, right? This is what it's all about. So if you have trainees, and so we know that trainees are a big part of the teaching process for students, for junior residents, fellows of residents. They're a huge part of that experience, yet sometimes they get left off. So if you want to encourage, if you see on your ACGMA surveys, perhaps, or you see on the block surveys, things about the residents not being adequately prepared to teach in one way or another, not always so eloquently stated, but then maybe encourage those trainees to take part in an observation process. Now, of course, this is intimidating for faculty members, even the most experienced faculty members. So you don't always expect that they're going to take you up on that offer. But we observe a lot of trainees, and they always at least say that they benefit from it. Faculty at any point on the continuum. The vast majority of, at least maybe not including the COVID observations, but the vast majority of our observations, I think, have been done for those folks who are already really confident in their teaching. They just want to get better. They want to improve. Oftentimes, somebody will have an observation, and then once you get one observation, you're like, okay, well, I'm going to work on that. And then 6 months down the road, they're asking you to come back and do another observation. And it may be in a totally different setting, or it may be in the same setting, to just see if they've incorporated the feedback. Anyone who teaches and anyone who seeks improvement in that teaching, we're here for everybody. So teaching is obviously multifaceted. Through Virginia Tech Carilion School of Medicine, we can consider all of these roles to be teaching roles. And why we think through this is because of the faculty bylaws, and our mission is focused on teaching for faculty, right? But we want to make sure that nobody feels excluded in that. So if you're doing teaching, you need to have a faculty appointment. And if you have a faculty appointment, you need to be doing some sort of teaching. So if somebody says, well, I don't give any lectures, it doesn't matter. Do you mentor somebody? Are you coaching peers or other learners? Do you develop curricula? Do you do education research? Are you a role model? Do you assess? Are you a researcher? Are you mentoring folks through the research process? All of those are included in teaching. So anything really associated with that, we can help you with. So here's some feedback from faculty who have been observed already. So I utilize the Teach Observation Program to help make small adjustments in my day to improve my teaching style while also running a busy office. I really love this observation. I remember it. The in-office observation provided me with effective feedback to streamline my teaching while still providing high quality care to my patients. I highly recommend this program for its practical and effective approach at improving teaching in medical practice. So this one was somewhat recently done, and I loved it because the environment was different than I was used to. It was an office where this faculty member was going from room to room. He was in clinic, and so he had 2 learners with him. We would go from room to room. We would start in a room. He would teach, he would take care of the patient, and I would notice something, we would go back to his office, which was right next to his patient rooms, which was really cool. And then the learners would, you know, follow up with the rest of the patient visit. We would go back, I would give him some feedback, and then he would go back and apply that feedback right in with the next patient. It was so cool. And so he was growing right within that half day that I spent with him. I spent a full half day in his office, and he grew the entire time. And now, since then, he's done another one. So that was really cool. And one of his learners at the end of this session said, hey, I'm really interested in teaching. Can you help give me some feedback on ways that I can get more involved? So that was really cool. And I happened to see her at our education grand rounds when she came. So she really was interested. Okay, next one. Many clinicians have no formal training in education. Traditionally, our only feedback comes from the learners themselves. While this feedback has been helpful, it's limited by the ability of the learners to identify and articulate opportunities for improvement. Very true. Sometimes learners will just know that something's off, or they don't feel heard, or they don't feel it, but they don't really know what to do about it, right? The observation process provides an outside view of one's own teaching from individuals with expertise. Having this perspective is invaluable in becoming a more effective teacher. Great. That's what we'd like to see. So where can we do these observations? Really anywhere. So lecture, we do traditional lecture, larger small group, in a lab facilitating PBL, the operating room, one-to-one. I've sat in several times on just somebody giving feedback in a one-to-one session. I mean, that takes, it's a different level of vulnerability, I think, for both the teacher and the learner, but they were both totally in on it, and they appreciated it. The learners were great with it. Bedside rounds. So remember our observation process is for whomever, whenever. We almost took out the whenever. I had a whole slide on whenever, but then we do have a lot of surgeons, okay? And a lot of surgeons would have us, and I'm not just picking on surgeons the way I like to do that, but they're like, can you do these sessions? Can you come and give us the same session at 5? I'm like, sure, we do 5 p.m. That's not the 5 they were referring to. So not always, we're not always going to be super available to do middle of the night observations or something like that. We will stretch and bend as much as we can, and we may have some super early morning people that are okay with that. But generally, whenever and wherever, we're good with that. So here's the little QR code if you want to take a little picture of that, and that will lead you right to the observation form if you want to complete that. One of the things that I think you can do to prepare for the observation is just one, recognize what you want to be observed on, right? Another thing would be potentially having sort of an informal observation, recording yourself or having a colleague or whomever observe you and just get some of the little nitty-gritties out of the way. And then just be as specific as possible in what you would like for us to look at. Or just say, you know what, I'm totally brand new, just tabula rasa, let me know what would work. Thank you so much for coming. If you all, I know a lot of you are wonderful educators already. If you would like to be a part of the observation team, you're more than welcome to contact us and find out how to do so, or we look forward to seeing you next time you'd like to be observed at any point on the experience continuum. Enjoy the rest of your day.